most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Right.
Don't forget Sam.
Right, Sam. We got to introduce Sam. Sam the skeleton. Today we're going to talk about what is causing pain on the side of your hip.
Right there.
There's two common possibilities. So yeah, first we got to let you know what we consider the side.
Yep.
And because a lot of people, when they get hip pain, they think it's back here.
Right.
And but the side is right on the side. Brad's going to show on the skeleton here.
Yeah. It's right. You know, a lot of people think the hip is up here at the belt line, but that's your pelvis. The hip is low. It's down here, right where this, right here.
Right.
And it is a little bit
See,
lower.
it's on the side, and this is where the problem area is, right here over the greater trochanter. So we're going to discuss what the two issues are now. The first one is trochanteric bursitis. Now, this is the one that is usually diagnosed.
Yep.
But according to the people I've been reading now, they think it's not as common as the second one, which I'll talk about
Sure.
also. So with bursitis, you actually, with over a lot of joints and a lot of bony areas, you actually have like a fluid-filled sac, and that's called a bursa.
Right. They're all over the body. They're in their knees, hips, shoulders.
Yeah, I think there's a number in the hip, isn't there?
Right. Well, number of the knees to it, but
Right.
regardless, they're there and they're a good source for pain because they can irritate a lot of nerve endings there.
Yep, and so that's what happens with bursitis. You got inflammation of the bursa, so bursitis, and you know it hurts when you do a lot of things, and we're going to talk about what those symptoms are.
Sure.
The second one that they think is actually more common now, but it is misdiagnosed because they're both present exactly the same. You know,
Same symptoms.
same symptoms,
Same
yep.
pain location.
Even everything. So this is a mouthful: gluteal tendinopathy. So this is the gluteus muscles. So gluteus maximus, a lot of people have heard of that. That's your butt muscle
That's
there.
that big, large
Yeah.
muscle.
The two smaller muscles, the gluteus minimus and the gluteus medius, are more on the side here.
Right. So yeah, they're more up above the top of the hip, and then they kind of fan out across the pelvis right here,
Right.
connecting down.
So the muscles come down, they narrow up into a tendon, and that tendon is degenerated or it's wore out a bit.
Right.
So, and that's why you're getting pain. So, all three of those muscles, by the way, Brad, they stabilize the hip. They move the hip, but they also hold that ball into the socket.
Yeah, right here.
Yep, it's just like the rotator cuff holds the humerus into the socket. Those muscles, so if they're not working right, if they're hurting, you're going to get that sloshing around. Excuse me. So, what are the symptoms? Again, they're both the same. And luckily, the treatment is the same too.
Right.
And we'll talk about that in the next video. Number one, you're going to have pain on the side of your hip. Now, it also may refer down a bit.
Sure.
It may go down to the thigh.
Yeah. So where the stripe is, you know,
Well,
right there's the side. Right there, I can feel that bone right there. And if I go like that, I can feel it very distinctly. And Bob says that pain will refer or go down this way. You have some.
I don't think it would go any further than the knee. Do you?
Probably not.
Unlikely. So, down to the knee. You have pain when you lie on the hip, directly on the hip. And a lot of people keep doing that, even if...
Well, if you have a habit of sleeping on your side, it's, you know, you fall asleep on your back and then you wake up on your side with a sore hip.
Right. Do you mind, Brad? I'm going to show something real quick here, too.
I'm sorry. I'm in your way.
So you don't want to lie on the hip, but it's also a problem if you don't lie on the hip. Let's say the hip is like this. Look how it's down.
Yeah,
it's
the
rotated.
femur he's talking about,
Yeah.
is angled down.
So you want to put a pillow
Oh.
between the legs.
I'll get one for you, Bob.
And that's going to be, I sleep this way, Brad, so I know. I'm of the age now, 60, where things like start aching just when you don't sleep right. So I was sleeping like this,
Yep.
and I was getting hip pain.
Yep, stretching
So-
it out.
So this is
You
a
ju-
very simple.
You just got to buy more pillows when you get older.
Well, I use a special pillow.
Oh, you do?
Yeah, a smaller one that's not warm, and because it gets to
We
be
don't
hot.
have. We don't have to know your issues. Bob.
All right. Number 3, you have pain when getting up from a low surface, or trying to get out of the car.
Right.
It puts a lot of stress on the hips, especially the.
Well, yeah, like if you were going to sit on this low stool, or even down here would really be a
Right,
issue.
right.
Oh,
You can see how much hip
stress.
stress there is on it. Yeah. You have pain when pressing on the side of the hip. So you know, and that's the tricky one because you think, oh, it's bursitis, but when you push on it, you're also pushing on some of those tendons.
Well, yeah, the location is very close to all this. But yeah, every time I have a patient, I'll go over here and I'll find that greater trochanter and I'll press on there and ow, they say, and it's like, yeah, it's right there. That's the spot.
Yep. Pain with going upstairs, running, jogging. Obviously, that makes sense. Sometimes people even have it with standing because you're putting stress on
Right.
these things. Aren't
Those
working.
things, when weight goes through there, things tighten up.
Sometimes a lot of people have pain with just even prolonged sitting too.
Sure.
It's just there's no movement going on, and joints don't like that, so you end up having pain.
Particularly when you get up, things are tightened up and they stretch a little. And
And number 7 is a waddle type gait. Brad's going to demonstrate that.
Trendelenburg?
Trendelenburg.
Yep.
That's the
That's
clinical version.
Yep,
name.
that's where you see that person kind of walking like this. And that's on one side. So my right hip right now
Is the problem.
Is the problem. I'm
Trying to protect it.
compensating. Yep.
Yeah.
Some people have both hips, and they
Right,
actually
right.
go
They're
both
back and
directions,
forth like that. Yep.
And both hips, either they're weak muscles, there's issues like this. There's a number of things that could cause it.
So we gave you the symptoms. In the next video, we're actually going to show you the treatment. These videos, this one and the next one, are part of a series of videos on hip pain. So you just go to bobandbrad.com, go to the hip pain videos, and you'll see all these titles listed. And along with it,
PDF printouts, right on paper, just print it out. You'll have the video summary right there with exercises on there, so
and
you don't
photos
have,
and the whole
and it's all free. It's,
the whole kit and caboodle.
Yep.
Do they still say that?
Oh yeah, that's a very common one, Bob. But I'm thinking, just remember bobandbrad.com and go to the program section, and then these will come up: back, shoulder, a number of things.
Yeah, well, a whole bunch of programs, free, no email. We don't ask for anything.
Right. Yeah, this
So,
is
we give.
This doesn't come about.
Yeah, very often.
It doesn't.
Thanks for watching.